Joined by Dr Mark Beach, and obviously Catherine Morgan-Wicks, the State Health Commander, will speak about vaccination, and Donna Adams, the Deputy State Controller, will join us as well to discuss any matters relating to police activity. Well, firstly, can I just start by thanking Tasmanians for working with us through this difficult period. We're now over halfway through this, and after another record day of testing, I can announce that there are no further positive cases as of this morning, which is very welcome news. In the past 24 hours, there's been a total of 1,769 tests collected by the laboratory. I want to thank Tasmanians for stepping forward to be tested, which is giving our public health officials great confidence in terms of the data that we're starting to receive. Importantly, Dr Beach will chat you through where we are with primary close contacts and other matters relating to the case. I do want to say that, in particular, testing continues to be high in the target areas. Clinics at Gagebrook yesterday, 359 tests. The Do and Entertainment Centre, there were nearly 250 tests, but the Do and Entertainment Centre does have more capacity, in fact around 3 times that capacity, and I'd encourage people that are looking for a test to utilise the Do and Entertainment Centre. And also at Mac Point yesterday there were 733 tests. Catherine Morgan-Wicks will provide more detail in terms of testing and what is going to occur today. I just want to touch on vaccinations. I want to say to Tasmanians, listen, great job turning up. Yesterday in our state clinics, more than 2,000 vaccinations were provided, and obviously outside of that we don't have the primary health numbers as yet, but we would be seeing our pharmacies and our GPs as well putting their shoulders to the wheel, and so testing was very strong yesterday. Importantly, in terms of single vaccination, now around 83.5% single vaxxed across the broader community, double vaxxed 68.4%. We're expecting that we'll hit the 70% double vaccination rate in coming days, and so I would say to Tasmanians, keep getting vaccinated. It is our best defence against COVID. And again, Catherine Morgan-Wicks will provide a little bit more detail there in a moment. In terms of police activity over the last 24 hours, there have now been more than 1,000 vehicles that have been checked. There have been around 90 that have been turned around because they were not where they should be. 16 infringement notices that have been issued, and unfortunately there have been 2 arrests, but Donna can provide further details in a moment on that. The other matter that I just want to speak about very briefly today is in terms of schools tomorrow. Students should not attend school unless they are the child of an essential worker or they can't be supported at school. And if parents have any questions about that matter, they should contact the Public Health Hotline on 1800 671 738, and we'll provide them with details in terms of who they should speak to in regards to the Education Department. But to be clear, schools will be open, but students should not attend. They are there to support the children of essential workers or those students that can't be supported at home tomorrow. Importantly, should anyone require assistance in terms of the Pandemic Leave Disaster Payment or the Pandemic Isolation Assistance Grants, which we've announced over the last couple of days, call either the Public Health Hotline on 1800 671 738 or reach out to Business Tasmania, which is also open today, on 1800 440 026 for any businesses that have inquiries about those matters. Importantly, I want to encourage Tasmanians to continue getting tested and, importantly, continue getting vaccinated. Now's the time that we really want to see a very strong effort, and I want to, as I've said, thank Tasmanians for stepping up yesterday, and I hope that we can see similar numbers today. It's important, especially if you have even the mildest symptoms, go and get a test. This is the time that we really need to understand that data. If you have any challenges as well, and I do want to just put these numbers out there again, if you're feeling anxious or concerned about any matter whilst we're in this lockdown and under stay-at-home orders, please call the Tasmanian Lifeline on 1800 984434, or you can call the 24/7 Lifeline number 131114. But before I hand over to Dr. Veitch, we're past the halfway mark, but this is a short, sharp 3-day lockdown. Importantly, we need to remain disciplined. We need to remain responsible. Importantly, if you haven't been vaccinated, drop into one of our walk-in vaccination state clinics. Importantly, get tested, especially if you have even the mildest of symptoms. We want to see a very good response there. With that, I'll hand over to Dr. Veitch.
Thank you, Premier, and good morning. And I'd like to reiterate comments of appreciation for the Tasmanian community, and particularly the Hobart community, for their widespread compliance with the requirements that have been imposed on them, and particularly for the people who have been getting out and getting tested or getting vaccinated. The fact that we've probably had between 300 and 400 people tested at the Gagebrook Clinic the last couple of days is great news, because it gives us outstanding information and gives us some confidence that there's not coronavirus in the community, or at least amongst those people who've got tested. So please, if you have any sniffles, even if you think you might have a sniffle, please go out and get tested. There's a lot of places you can go and get tested in Tasmania, and particularly around Hobart today. So I'll just give you a bit of a run through of the management of the contacts, because that's the principal focus of public health activity at the moment. We've currently identified 168 primary close contacts, and these comprise people who were at Woolworths, people who were on the flight, at the airport, and in the household where the case was when they're out of quarantine. Of those 168 primary close contacts, we have 95 tests back that are negative, and we will get the remainder of those tests back today, and possibly some tomorrow. If we look at a little bit more detail at those primary close contacts, the people who are most at risk are the household and household-like contacts. There's 15 of them, and 11 of them have tested negative, and we're expecting the results of the other 4 today. We ended up with 126 people classified as primary close contacts because they are at Woolworths at or around the same time as the case, and of those 126 people, we have 67 negative results back, and again expect the remainder of those to come back today and tomorrow. Beyond the primary close contacts, we have a number of casual contacts, who were people who had more remote contact with the case, and lower risk contact with the case. Of those 19, 9 of them have already tested negative and been released, because that's the standard practice with people once you clear them 5 or 6 days after their exposure. And there's another 10 of those 19 casual contacts whose results we expect will come back today. We've identified no new exposure sites, and as the Premier said, there's been a high level of testing around the state to support the public health response. Premier noted that we are over halfway through our 3-day lockdown, a bit past the halfway point. It's a short lockdown with a focus on ensuring that we do thorough contact tracing and assess the risk in the community where the case may have posed a risk. And those processes are going satisfactorily, but we'll obviously be taking into account the information that we gather today and first thing tomorrow in using all the information we can gather to provide the right guidance on what happens after 6 o'clock tomorrow night. So I might leave it there.
Is this looking likely then that we will end this lockdown on Monday?
We've not identified any cases, but we still have around about half of the primary close contacts to get information on. I'll be in a much more confident position to provide advice about that tomorrow.
And how long a lead time do we need to know that these people haven't actually got coronavirus?
The initial testing of those people gives us one lot of information that they have or haven't been infected, but it's important to remember that all of the 160 odd close contacts are going to be in quarantine for 14 days. Come tomorrow night, most of them will have been in quarantine, or it'll be about a week since their exposure. I should correct that slightly. These people will be in quarantine for 14 days after they had exposure to the case. So, for example, those people who were in Woolworths on the Tuesday afternoon, their quarantine is going to go until not next Tuesday, but the following Tuesday. So this first round of testing will have picked up whether or not anybody is presenting as a new case in that first week. That's the most likely time for people to actually test positive, but there is still a smaller possibility that they test positive later on in their quarantine. But of course, by that stage, they're in quarantine and not posing a risk to other people. So it is possible to change measures, even though you subsequently get a case of people in quarantine, because they're in quarantine and not posing a risk.
And what about wastewater? Have we had any tests back from wastewater?
We'll be getting those tests back, I think, in the next day or so, but we certainly haven't had any positive wastewater tests. Usually when this happens, we actually do some additional testing sites or increase the frequency of the wastewater sampling, so that we haven't had any positives yet, but we'll get more results through the course of this in the following week.
Queensland Health is saying to people that have been in Tasmania since the 11th of October onwards, to monitor their symptoms. What's your message to people who may have travelled interstate?
My message to anybody in Tasmania all the time is if that you've got any symptoms that could be COVID, go and get a test. It's pretty easy. There's tests all around Australia, whether you're somewhere in Tasmania now or whether you're somewhere in Queensland.
Are you confident that all of the close contacts of the man have been quarantined, given he wasn't completely honest about where he'd been?
I think the fact of the man not disclosing all the places that he's been does dent my confidence in to be able to say I'm absolutely certain that we've contacted all of the primary close contacts. We've contacted all of the I'm pretty confident we've contacted almost all, if not all, of the primary contacts who have been at the places that we've identified where he's been. One of the reasons, of course, for doing a lockdown is that lack of complete confidence that we've actually got all the exposure sites identified. It's why it's important that people in the community who have symptoms or may, for reasons they may or may not want to disclose, perceive themselves possibly to be at risk, it's important for them to go out and get tested too. That helps us cover, if you like, the gap between absolutely complete contact tracing and exposure site identification and what we can achieve in practice.
How experienced are our contact tracers, and are they people who were already working in the health system? Or
the contact tracers are doctors and nurses. They're usually nurses with some years of experience at a sort of nurse consultant level, but supported by other nurses at other levels of experience. There's experienced mentors, training programs, and clearly these people turn over, but at the moment they're working 2 shifts a day and covering the work quite sufficiently. So they're an experienced lot, and there's lots of national guidelines and standards that we adopt and achieve the standards.
And given that we haven't had a lockdown since, sort of mid last year, and barely any COVID cases in Tasmania, how have they been sort of keeping up their practice in that period of time?
Well, during the time, in the meantime, and it may not be obvious to people, but we've almost always got some contacts and close contacts being managed in Tasmania of somewhere in Australia where there's been cases or a risk. So they've actually been managing people who've often recently just arrived in Tasmania from another jurisdiction, where they might shortly after they come here be identified risk. So we've actually been managing contacts for almost all the time there's a contact or a number of contacts from an interstate exposure site in quarantine of one kind or another in Tasmania. That keeps them in practice. They've also, from time to time, offered some support to some of the other jurisdictions that have been under pressure and helped them out with some remote case interviews or contact management.
Do we have enough contact tracers?
We have enough to manage the situation in front of us at the moment, yes. and we have surge plans to manage increasing numbers of cases, bringing on other people who have previously been managing, who've previously worked in the area. We have a surge capacity to use call centre type arrangements if we need to manage a large number of lower risk contacts. And we also have a quite sophisticated electronic system of reaching out to people and getting information back from them electronically and being able to use that to more efficiently identify whether contacts are actually at risk.
Do you think that airlines could help out, or airline staff could help out public health by monitoring passes, that G2G passes that travellers have before they hop on a plane and actually get to Tasmania? Could they assist in any way?
It's not the airline's job to do that. Tasmania has a well-established plan for managing entry into the state, requiring people before they come here to enter, use the appropriate Tassie Traveller or Good to Go pass. Over time it's changed a bit, but that information on what you need to do when you come here has been made clearly available to people, and when those people, they fill it in, if they work through their process, it'll tell them whether or not they should be coming here or not, and then when they've completed it, it's seen by our biosecurity staff at the border who manage it very well.
If one of the man's close contacts does end up testing positive, how will that, or how might that affect lockdowns?
We will look at a number of factors in the information. If we get a positive, it will depend whether it's a close contact of that person or a remote contact of that person, someone who was at Woolworths or even someone who we haven't previously identified as a contact. And you can see that if it's a close contact, that's not entirely surprising that we might get a case amongst them. If they're a more remote contact who, like someone who had fairly fleeting encounters with the man, that would be greater concern. So if we identify a case amongst this man's contacts, we will assess the significance of that. Do we know where they got it from him? And have they posed a risk? So if they test positive, were they in the community when they were infectious? With so many people into quarantine now and the days ticking away, it's likely that most cases, if any, are diagnosed in the next few days will be people who were in quarantine at the time when they could have been infectious. And that means that there isn't much risk to the community, and we take that into account when we're considering the need for lockdown measures.
Have you found that the primary close contacts of this man have been just as non-compliant as him, or are they being a little bit more helpful?
We've been in discussions with the primary close contacts. We need to understand what their links are to the case. We've got, in any of these situations, you get a variable amount of information from people. So I'm not going to go into the detail of it. But we've had enough information to, I think, establish the management process as we've got going at the moment. And if we've been in any doubt, we've had some alternative mechanisms such as closed circuit TV and so on to verify key elements of the information we need.
What's this man's condition at the moment?
I'm not aware that he's in any clinical risk from his illness, but I don't have an up-to-date case clinical report on him. It's not his clinical condition is managed in the case management facility with InReach from the Tasmanian Health Service.
And how do you feel about him being identified in the media?
The media does what the media will do. I've been a doctor for 35 years, and I've always held it to be pretty important to preserve confidential information so I can have the trust of the people I work with. As a public health practitioner and as someone with a statutory role under the Public Health Act, I'm also aware that enables me to have access and use information that's not publicly available. And I and the people with whom I work and to whom some of these powers are delegated also act responsibly with preserving the privacy of that information so they can do their job. We've got to be able to have the public trust the public authorities, such as public health. Let me give you an example. Imagine someone is in, let's say, Newtown over the coming days, and they get a bit of a sniffle, and they live in a household with a couple of children who'll be going to school, I hope, later next week. And they feel that because of this identification of this person in the media, oh, gee, I don't want that to happen to me. I'm just going to live with this sniffle. It won't be COVID. And they turn out to have COVID. And the children go to school. And that's because this person hasn't trusted that by coming forward and participating in a public health response, they'll be treated in a way that preserves their confidentiality. So it's a long answer, but my point is that I want the public to trust public health, to manage their personal information privately, and to have no reservations about coming forward if they think they could have COVID or be a contact of someone with COVID, to get tested or engage with public health. We'll look after your privacy and your personal information.
The situation is a little bit. Do you think this situation is a little bit different, though, just given the severity of it and the lockdown that this one person, one individual, has caused?
Yes, it is a more severe situation. It absolutely is. But I don't believe that that changes the principles that I apply to managing personal information.
We'll just move to Catherine.
Thanks.
Good morning, everyone. One of the most critical considerations for lifting southern Tasmania out of lockdown is high levels of targeted testing and lifting the vaccination rates of low vaccinated communities. These two factors, testing and vaccination rates, will also apply to help stop lockdowns in future. That is why we stand here day after day asking those in the community who are not yet vaccinated to please walk into a vaccination clinic today. Southern Tasmania has done an amazing job at locking down, but today, when we are locked down with no other plans, I'm asking you to please get tested if you have symptoms. Get your children tested if they have symptoms, and please go and get vaccinated today. Yesterday was another record day of testing, with 1,769 tests conducted, including 359 at Gagebrook, 733 at Mac Point and 239 at the Deck. Over the last 3 days, 4,373 COVID-19 tests have been conducted, which is a fantastic effort, and thank you to everyone that has come out to get a test. I encourage everyone, if you have symptoms, no matter how mild, isolate and get tested immediately, and then isolate until you receive a negative test result. Importantly, even if you are vaccinated, you need to get tested if you have symptoms. If you need to get tested in the south today, please visit My State Bank Arena, formerly the Derwent Entertainment Centre car park. This will be open until 6 p.m. today with no booking required. And the cars are flying there very freely at the moment. You can basically drive up, get a test and drive out. We have testing at the Chris Fitzpatrick Memorial Park, Gagebrook, with testing available until 9 p.m. again this evening. No bookings are required. Please just turn up and get tested. And when we last checked, we had about 50 cars at the line at Gagebrook, but they are moving very freely. Macquarie Point in Hobart is open until 9 p.m. this evening. To make a booking for this clinic, please call the Public Health Hotline on 1800 671 738 or go to the coronavirus website to book a test online. We've already tested several hundred at Mac Point this morning, with another 500 that are booked today, so it's looking like another big day at Mac Point. In terms of vaccination clinics in southern Tasmania will all be open extended hours from 9 a.m. to 9 p.m. again today, and we'll be accepting walk-ins and booked appointments. And I really want to push vaccination sites at Bridgewater and the goods shed here in Hobart, which have the capacity to do hundreds of vaccinations today and tomorrow. So our vaccination sites open today are Brighton Civic Centre at Bridgewater, Princes Wharf No. 1 and Hobart, and the goods shed at Evans Street in Hobart. And tomorrow, Monday, in southern Tasmania, in addition, we have PW1 again. We have Mona, our Berrydale clinic, which is a new one at 9 a.m. to 5 p.m. We have Blunston Arena, Bellerive, 9 a.m. to 5 p.m. We have Your Church Moona, 9am to 5pm, and in Ooze, Central Highlands Community Centre from 9am to noon. And we are very keen to see as many of the 300 strong population in Ooze please turn up to get vaccinated tomorrow. And to our community leaders, please support your community to get this message and to drive them there if they have transport issues. We also have a new clinic, which I can announce at Hamilton, Central Highlands Council Hall, 6 Tarleton Street, from 1pm to 4:30pm Monday. We have not had much lead time to publicise this new clinic, so please, Hamilton residents, come out and support this clinic. We know we have a population of just over 200 people in Hamilton, and we could vaccinate 100% of Hamilton tomorrow if you come out if you're unvaccinated. In terms of our Mona clinic, I'd like to thank David Walsh for allowing us to continue to use Mona, even though it is closed for the lockdown. In addition to these, a clinic will be held at the New Norfolk District Hospital on Tuesday the 19th of October and Wednesday from 9am to 5pm. PW1 and Moona will continue for the rest of the week, and Blunston Arena is also open Thursday and Friday. So we are now over 68.4% fully vaccinated and 83.4% have had a single dose. And pleasingly, these numbers continue to lift across the Brighton and Southern Midlands LGAs, and there are clinics in Central Highlands and the Derwent Valley this week. This has been achieved through both bookings at our Bridgewater Centre and with over 500 walk-ins in the last 3 days. The 7030 postcode has grown by dose 1 participation by around 6%, so almost 1,000 people, and we continue to be open for the next 2 days at Bridgewater to try and lift this vaccination rate even further. As I said yesterday, it will be a fantastic outcome if we can lift this vaccination rate into the 80% range in the Brighton LGA by the end of Monday. Yesterday at state clinics, we administered well over 2,000 dose 1 vaccinations across the state, and this included 924 children and young people at PW1, 419 people attended our Bridgewater clinic, 351 people walked in at the goods shed, and 430 people turned out in Moona. And yesterday we saw around 6% though of our bookings not show up for your appointment. If you have a booking, please continue to turn up. In lockdown, you are permitted to leave your house to attend a vaccination or a testing appointment. And again, I'd like to remind the North and North West that there are plenty of bookings available this week in the North and North West. Please don't wait, vaccinate.
Do you feel like this lockdown has accelerated vaccination rates from what you were projecting that they would be at this time?
So pleasingly, we've seen a real positive lift in terms of vaccination rates. And certainly in visiting my Tasmanian Vaccination Emergency Operations Centre, there's an extra spring in the step of everyone that is there. They are working incredibly long hours to try and stand up these additional new clinics, and we are throwing everything that we've got at vaccination this weekend.
Does it look like we might get to that 90% well before Christmas now?
So it is assisting our push towards that 90% vaccination rate. We haven't changed our dates yet in terms of our modelling for the 90%. We want to see how we are actually going through this lockdown period, and we'll have more to say on that this week.
And what about testing rates? Do they need to stay at these record levels in order to be comfortable to lift the lockdown?
So every extra test is actually going to get considered in terms of the lockdown restrictions that public health will consider, particularly over today and tomorrow. In terms of these record levels, it's really pleasing to see those record levels. We do need to make sure that it is targeted testing and that we are getting testing into the postcodes and areas of which we're concerned. And we've really seen with our Gagebook numbers, so again, very, very strong numbers yesterday. We're still seeing a good turn up today, so we're very pleased with that.
And before this Southern Tasmanian man tested positive, were rates climbing for testing, or were they stagnating or perhaps decreasing?
So we've had quite a few strong weeks of testing. So we've been seeing around the 800 to 900 tests actually being performed a day, and that's probably due to the prevalence of some of the cold and flu-like symptoms that we're seeing across the community at the moment, in which we're also seeing presenting in terms of respiratory illness at our EDs. So we have had quite strong testing rates, but not at this level of the 1500s and 1700s. So really fantastic to see people just absolutely looking at their symptoms, you know, and I know in terms of hay fever symptoms, it's easy to think I always get hay fever. Don't let this day be the day that you actually confuse hay fever with a symptom of COVID.
And what about vaccination rates as well? Had they been rising before this man entered the state?
So with our vaccination rates, we were probably heading towards, you know, that difficult to reach territory. So every step that we take beyond the 80%, and we're now over that 83% first dose vaccination rate, it is getting harder and harder. But really pleasing to see that, you know, that has not been the case during the lockdown. We have seen people coming forward with the amount of walk-ins we've seen at Bridgewater and the amount of walk-ins, for example, at the goods shed yesterday. But let's use today where people are at home, you know, they can't do any other activities. Please, if you're unvaccinated, come forward and get vaccinated.
Does anyone have any questions for Donna Adams?
Yep.
Good morning, everyone.
Can you just tell us about those 2 arrests that have been made and what they were in relation to?
Yes, we had an arrest of a male in the northern suburbs on Friday evening. The male was arrested for an unrelated matter, but as part of the investigation, it was identified that this male had a gathering which was outside of the public health restrictions. So the person has been fined in relation to that breach.
And how many people were at this gathering?
I don't have the details of the gathering. It was just outside the public health directions in terms of how many could be at the house.
And so did you get?
That's a $778 fine, 50 cents.
And in that situation, is it just the person who holds the gathering that gets the fine, or do the people that also turn up also get fined?
At the moment, this was in relation to, as part of the investigation for the arrest of this particular individual. So it was him for holding and organising the gathering.
And there was another arrest?
There was another arrest of a male in Kingston. This male was not wearing a mask. When he was provided advice by police to wear a mask, he refused. He then became abusive and he was arrested.
And what sort of penalty does that attract?
Well, this particular individual will go before the courts, and so that's a matter for the magistrate.
And can you give us an idea of the other examples of non-compliance you've seen over the last sort of 24 hours?
Over the last 24 hours, we've had 3 individuals failing to comply with a mask requirement, and those 3 individuals received a caution. We have had a further 2 cautions for people failing to comply with the direction, the public health directions, in that they didn't have a permitted reason to leave their residence.
And when do you anticipate police can, I suppose, look into further penalties for this 31-year-old man? Do you have any projections for when you can take over that investigation?
Well, we'll work with public health, and as soon as the Director of Public Health advises that he's content with the public health response, police will commence investigations in relation to the actions of the individual.
Are police hearing any concerns about people heading to their shacks over the weekend and trying to avoid lockdown?
Tasmania Police has got a presence at 4 checkpoints that surround the 12 local government areas that are restricted. Vehicles, and there's been 90 vehicles where the drivers have been directed to return back to their primary residence.
What about in places like Orford, say Swansea, Coles Bay? Are police around there just checking people haven't absconded to their shacks?
Police are on one of the main arterial roads that leads to the east coast.
Why are some people cautioned and some people are charged? What's the difference there?
What we're trying to do is take an educative approach, and we are trying to provide advice to Tasmanians and giving them advice around what they need to do to comply. When they fail to comply, then police will resort to an infringement, or in the case of this one individual, he was actually arrested.
Move to questions for the Premier.
Labor is speaking today and is pushing for airline staff to have a greater role in monitoring travellers' G2G passes before they hop on a flight to get to Tasmania. I mean, what's your stance on that? Is there a greater role that airlines can play in this?
Well, early on in the pandemic, we spoke with the airlines. They have chosen not to play a part in this. And the point that I've made on a number of occasions is that lawfully our reach extends to the Tasmanian boundary, to the Tasmanian border. We have no lawful role to play in Victoria or New South Wales. So what we have been doing is ensuring that at those airports that people are provided with information in terms of what they need to enter Tasmania. But I'd make this point, it has only been a couple of individuals, a very small number, that have decided to actually come to Tasmania without the appropriate passes.
So really the onus is on the individual in this situation until they reach Tasmania.
Well, they understand what the law is, and that law is that they need to have a pass to enter Tasmania, and if not, they're picked up at our borders, which is exactly what's happened in the most recent cases.
We're hearing from some small businesses who can't understand what's available for them in terms of turnover compensation, any relief to cover wages, support staff, overheads, forward bookings being cancelled. What's available to them?
Well, we'll work with the business community as we work our way through this, and as I've said, I'm hopeful that we'll be out of this tomorrow night, as we have planned to be. We couldn't be in a better position as it stands today in terms of the information that we're receiving, both in terms of the number of tests that are occurring, but also, and very pleasingly, the fact that we're not seeing any more positive cases at this time. But again, as Dr. Veitch has said, that can change, and we just need to be mindful. But again, one of the things I'd say to business, we'll work with the business sector as we open up and consider the challenges that they have faced as a result of this. But importantly, one of the things that we do know is that when you do come out of lockdown, the economy snaps back very, very quickly. And so I would expect that most businesses, should we come out of this on Monday evening at 6 p.m, will be very busy for the coming week, and I would hope that would provide businesses with some comfort as we move forward. But importantly, I would, as I've already indicated, note those hotline numbers, and if people have any questions, they should contact those hotline numbers. Importantly, in terms of staff and in terms of those that are asked to go into quarantine, there are support packages available for staff, and importantly, for those staff that have been affected by the lockdown, there are packages available for them.
Are you worried, though, that some businesses might seek damages over this?
Look, this has been an ongoing challenge as we've worked our way through this, and again, as a government, we have responded on every occasion. And I've always said that if there's more to do, then we will do that. But again, what we're attempting to do, and I would hope business would understand this, that we're looking to protect them, their families, their staff, their customers as a result of what we've done. And by taking the immediate action that we took, I would hope that we can come out of this quickly, as opposed to being into a longer lockdown, as we've seen in New South Wales or Victoria.
Will there be an investigation into this breach as has happened in Victoria?
Well, in terms of this breach, I've explained very clearly what has occurred, and that is currently being looked at by the State Control Centre in terms of how this occurred. There were two options that this gentleman could have used. One was out the window, one was out the door. I explained yesterday that in terms of if they left out the door, then the only opportunity would have been when the security guard on that particular floor was changing out of their PPE. That matter, to be frank, I don't think there's very much more than I can add. But again, we're looking into it, and if there's further details that we can provide, we will.
Is the State Control Centre, though, the right body to look at it?
Well, look, if you're
Are they
looking,
independent enough?
well, again, there are only two options here. And I'd make the point that breaches in other jurisdictions had largely occurred as a result of the virus leaving the facility as a result of a PPE breach. Now, in this case, this individual, on all accounts, appears to have arrived in Tasmania with a plan to evade authorities and to leave quarantine.
Which security firm was present at the travel lodge at the time?
Look, I don't have those details.
Should there be army people at those facilities?
Again, challenges that we have faced in terms of hotel quarantine, have largely not been within the domestic circumstance. One of the things that we do is we have very strict directions in place. And in terms of that, in the main, with more than 13,500 people that have gone through our hotel quarantine system, there have been very few. In fact, as I've indicated, only 3 breaches from 13,500 people.
Could those breaches have been avoided if perhaps there was more security or more CCTV availability?
Well, in terms of security and CCTV, we've already increased the level of security, and as I've indicated, any gaps in terms of CCTV have been improved as well.
Thanks, everyone.
Thank you.